Assalamu alaikum and a very good morning to all of you. My name is Dr. Tanzila Sheikh and I'm here to present knowledge regarding precancerous lesion which is most common in Pakistan known as oral submucous fibrosis. First, let's have a look at the learning objectives of this session. So at the end of this session, the student of BDS third year will be able to define oral submucous fibrosis, describe the frequency of this condition in Pakistan, list the causes of oral submucous fibrosis, distinguish among its clinical stages, identify the signs and symptoms of the patient that comes to the OPD, suggest diagnostic measures, manage the complications, execute the treatment options according to the condition, and also implement the preventive measures to make the society a better place. Starting with the definition of oral submucous fibrosis, it is defined as a chronic complex pre-malignant condition of the oral cavity, which is characterized by a juxtaepithelial inflammatory reaction that leads to progressive fibrosis of the submucosal tissues. In 2014, at Ziauddin University Hospital, a research was conducted to see the frequency of oral submucous fibrosis among the gender, that is male and female, and also the age that is most commonly affected by this lesion. The results showed that 88% of the individuals affected were males, whereas the remaining 12% were females. Among those 88, the most common age group affected was 11 to 20 years. That gave the ratio of 73%. After this age, the most affected age group were 21 to 30 years of age. That showed 21% of the affected individuals. So, it concludes that oral submucous fibrosis is mostly found in young males. Let's discuss the causes of oral submucous fibrosis. What are the factors that results in this condition? Among the various causes, chewing of betel quid and erica nut is an important cause. Role of tobacco and alcohol, genetic factors, and nutritional deficiencies. All these factors are interlinked and play a major role in the progress of this precancerous condition. The three clinical stages of oral submucous fibrosis includes stomatitis, that is inflammation and redness of oral mucosa that leads to pain and difficulty in speaking and eating. The second is fibrosis, that is early lesions and blanching of the oral mucosa that further leads to formation of fibrotic bands that limits the mouth opening. The third is the sequelae of oral submucous fibrosis that results in the formation of leukoplakia and also results in speech and hearing difficulties. The other sign and symptoms that helps to diagnose OSF, that is oral submucous fibrosis, includes trismus, that is limited mouth opening. In a normal individual, the mouth opening is usually up to 40 millimeters, although the patients who are affected by OSF has a limited mouth opening that is less than 15 millimeters. The next is the oral ulcers, in which there is inflammation of the oral cavity or oral mucosa. The patient comes with a complaint of pain and multiple ulcers. Burning sensation, in which the patient complains of burning in the mouth despite of the fact that he hasn't eaten any spices. Along with burning sensation, the individuals affected has also complained of altered taste sensation, in which they feel the taste sensory receptors are not working as they used to work in normal days, and also speech difficulties in which the individuals suffering from limited mouth opening also complain of hearing loss and speech problems. The diagnosis of this lesion is basically done by three ways. One is clinical examination, in which there are certain features which we can see on oral examination. And that is the blenching of the oral mucosa, the vesicles, the mucosal ulcers, the pigmentation, and patagy. Whereas the other method of diagnosing this condition includes the biopsy, that includes the incisional and excisional biopsy. The histopathological features that is visible in biopsy includes epithelial hyperplasia, marked edema, thickened collagen, large fibroblast, and congested blood vessels. The other method that we have for diagnosis of OSF is ultrasonography. The treatment options for OSF includes change in the lifestyle, in which the individual has to quit few habits, that is drinking of alcohol, eating of tobacco, and beaten and areca nuts. The other option is the use of medications, in which we use anti-inflammatory drugs to reduce the chronic inflammation of the oral mucosa. The third includes the physiotherapy and oral exercises to improve the mouth opening. And the last is the surgical interventions, which is used in advanced level, in which we excise the fibrotic bands that limits the mouth opening. The management protocol regarding this condition includes SCORM, in which we advise the patient to stop the habit. We counsel the patient in order to promote healthy lifestyle and quit bad habits. We instruct the patient to go for oral physiotherapy. We give them medications and also educate the parents, as most of the affected individuals are young males, to stop their habits in order to avoid its transformation into a malignant formation. Regarding the prevention of oral submucous fibrosis, three steps can be followed. One is the education awareness, which promotes healthy lifestyle and stopping the bad habits. Promotion of healthy habits through seminars and through education, and also promoting regular dental checkups, in which the dentist keeps an eye on the oral mucosa health, and also advise and counsel the patients regarding the cessation of the smoking and alcohol habits. Let's summarize this session. In this session, we have discussed the definition of the OSF along with its frequency and the causes. We have also discussed the clinical stages with multiple signs and symptoms along with its complications as well, and also multiple treatment options and management protocols along with preventive measures that can be performed in order to decrease the rate of oral submucous fibrosis. These are the references that has been used for this session. All these are mentioned in your study guide. You can refer to your study guides for more details. Thank you so much for your time and patience. That's all for today's session. Any query is appreciated and will be answered on the given email ID. Happy learning to all and good luck.